Why your heels hurt in the morning and how to stop it. Welcome to Archmaker, where better steps begin. And I am Dr. Po Raval, 35 years as a podiatrist in private practice. So why do our heels hurt in the morning? There are many reasons, but let's just talk about anatomically what could be going on. So here is your heel bone. One of the first things we check for is whether your Achilles tendon, and it's not shown here, but your arch muscle or your plantar fascia muscle are tight. Two of the biggest reasons why heels hurt. Number two, over time, if that pulling keeps happening, you end up with this little bony growth, and that's called a heel spur. So you're standing and sitting and walking right on this bony nail looking item that has grown out of your heel. Number three, you could be also tight anything from the hip down. That means your hamstrings, your quadricep muscles, your calf muscles. As you walk, if any of those are tight, it will also tighten up these two muscles. Number four, weight. So unfortunately, weight does figure in. If you are overweight, it will affect your heel. Remember that in here is all tissue, which is shock absorptive. So if you have extra weight on that, that shock absorption is not working for you as well as it can. Lastly, autoimmune diseases as well affect heels. So there's certain autoimmune diseases that cause heel pain and certain autoimmune diseases that also cause nerve pain, which is burning, shooting type of pain. So how do we treat this? So number one, if somebody comes into my office with heel pain, this is the game plan I give them. Number one, we test right in the chair whether you're tight, your Achilles tendon or plantar fascia muscles are tight. Then we watch you walk to see if there's tightness or one leg is longer or shorter than another, if that's affecting the tightness of the heel. Next, we send them for an x-ray to see if there's a heel spur. Overall, the way to treat, and then by the way, we also send for if there are other symptoms, abnormal tightness, something that triggers something in my mind that this is not the normal heel pain in the morning, then we also send them for a blood test to see if there's any autoimmune. While all these things are coming in, we start them on either a custom orthotic or an over-the-counter orthotic, depending on whether there are other bony deformities. We send them for physical therapy next. Why? Because physical therapy will do a full body evaluation on what is actually causing this tightness and treat that tightness. And that is done with heat, deep tissue mobilization, stretching program, always ending in ice. It's very regimented, and it will also give you a stretching program that is not haphazard. Also at night, we used to give these, if you're tight, then we used to give these boots that were like boots that you can wear overnight. I designed Archmaker, which is based on many of the dancers I had. It's in the dancer's point position. It'll release your plantar fascia and stress your extensor muscles. You wear this at night, 4 hours a day at night at least, for 4 weeks while you're in physical therapy, because remember, you're doing something at night, you're doing something during the day, but you're not doing anything at night. What causes heel pain first thing in the morning is that you've tightened up overnight. So you want to use something at night, and I recommend Archmaker. You can get that on our website, archmaker.net. It fulfills through Amazon. Lastly, if none of these things help, we usually put someone in a walking cast boot, which is a hard boot that stops all the pull of this. This takes about 4 weeks. And lastly, if there is no benefit from the hard boot, using Archmaker at night, using orthotics during the day, finishing physical therapy, weight loss if you need it, then you go on to surgery, which is extremely beneficial, and it really is nothing to be afraid of. What we do, it sounds horrible, but we scrape off your heel spur and then release your plantar fascia muscle. So that is done outpatient surgery. The whole surgery takes less than an hour. and we are able to mobilize you right away so that plantar fascia stays stretched. It's a permanent solution for this problem and very, very effective. So don't be afraid of it. So that's what causes heel pain first thing in the morning, and these are all your treatment methods. Stay tuned and subscribe.